Hello, everybody. My name is Dr. Andrea Kossler. I'm one of the surgeons at Stanford Health Care. In the spirit of Rare Diseases Week, I'd like to share with you a personal story about a rare condition that's near and dear to my heart, FOXG1 syndrome. And I want to introduce you all to Nasha Fitter. She'll tell us a story about her beautiful daughter, Amara, who was diagnosed with FOXG1 syndrome at the age of 7 months. Nasha, thank you so much for joining us today. I am so excited to tell your story, and I'd love for you to tell everybody your journey with FOXG1.
Thank you so much for allowing me to share my story. It means so much to me. As you mentioned, Amara started having seizures at 7 months of age, just a little baby. And a few months later, we received her diagnosis that she has a mutation in her FOXG1 gene. And it was truly probably one of the worst diagnoses that we could have received. Even though FOXG1 is a teeny tiny gene, it transcribes to hundreds of other genes. And so it creates a pretty large problem in the body. So when I received the diagnoses, I immediately, even though I was told not to, went online and found out that most children don't walk, they don't talk, they're fed by a feeding tube, they suffer from seizures and movement disorders. And for any parent, I think it's probably the worst thing that you could experience. And I went through a period, several months of just extreme grief, thinking about all the things that Amara would not be able to do and the fear of just the unknown of what her life was going to be like.
Gosh, I can't imagine what that's like as a parent. My heart breaks for you. But what did you do about it? How did you overcome this?
So at a certain point, I had an inflection that either I was going to continue to grieve and to feel sorry for myself and why did this happen to me? Or I was going to say that I will not be a victim of my circumstance. And I'm going to take, which for me was the biggest tragedy of my life, and turn it into the biggest inspiration. And it was going to become my life's mission to find a cure for FOXG1 syndrome. And it was going to be much bigger than Amara. We were going to find it for all kids affected by this disease.
I just absolutely love hearing you tell your story because it's so inspirational. And I just want to know, how can we help you to find this cure? We're all in this fight together. So what can we do?
Thank you for saying that because I do feel like we're all in this together. And something I've learned is that when you have a pure purpose and you're doing something with that purpose in mind, that everyone will come together and help you. So, from the Stanford community to people in industry to FOXG1 parents, like we have all banded together and are fighting for this disease. We've been able to form one of the best scientific advisory boards in the world. We have scientists all over the world working on this condition. And we hopefully are just a year away from our first clinical trial. So it's exciting times. And I think, I hope that everyone will consider donating to a rare disease. 1 in 20 people in their lifetime will be affected by a rare condition. And the problem is that most people, when they donate, will donate to cancer and conditions where you have a large population affected. The issue then becomes that rare diseases are completely underfunded and there are no treatments. So my ask would be, look at your philanthropic giving portfolio for the year and find a rare disease that you can get passionate about and give to that disease. And if everyone does that, we will find cures and solutions because they do exist for these conditions.
Nasha, I just absolutely adore talking to you. And it's amazing to hear that 1 in 20 people have a rare disease. We should all be supporting a rare disease, and FOXG1 should be the disease that we support. So, what other closing comments do you have for us? And I will share the information of how people can help at the end of this talk.
Thank you so much, Andrea. My closing mission, my closing thing is what I tell all people is that, look, I am a normal, everyday person. I don't have a science background. I don't have tons of contacts. And I have been able to do this for my community. And any one of us can take what we think of as a tragedy and turn it into hope and make our life's purpose around that. And any normal person can change the world. And so that is if anyone takes anything away from this talk, it's that.
Take tragedy and turn it into hope. I've just always absolutely been so inspired and motivated by you, and I hope that we all will and we can all give to FOXG1. Thank you, Nasha. I'm really excited about posting this and sharing Rare Disease Week so that people can really get excited about a rare disease, including FOXG1. Thank you.
So much, Andrea.